Well, hello, it's Nancy today. It is, yes, it is. Still day 12. I was going to try and make a video every day for people that are having their hips replaced or have already done it or know someone who will. And just sort of to give you a little idea, straight from the horse's mouth, being as I'm somewhat like a horse, if I can talk. Well, we won't even go there. Anyway. So here I am. I just had some of this most wonderful food. Let's see, what is this? This is some soup, and this is some rice. I'm so grateful for these people that have sent me food over. Otherwise, it would be whatever you can stick in the oven and out. What's the one thing I was having? Oh yeah, TV dinner. Or frozen blueberries. Not a bad thing, frozen blueberries, Anyway, so let me see if I can think about what I should tell you of an update. So today, I went downstairs. First time since I went down to go to the doctor yesterday, but today I just went down to be downstairs. And I was able to sit on a regular chair, not a lazy boy, but a sort of idea. The one I sit in all the time up here is an electric, what do they call it? Not ejector chair. It's a similar idea. You push the button and it'll lift you up until it dumps you on the floor. Well, it's really good. In case you forget to take your finger off the button. It'll let you know when you're up high enough. Gosh. So, as you can see, my eyes are drooping again. These medications, I tried to put it off a little bit, taking my pills, and I paid for it. Never do that. This is day 12, and they have me on 2 Tylenol, extra strength, Trendol, and Hydromorphone. So those 4 pills are what I take all the time, every day, every 4 hours. And then I also have a Zortzel XZ, I don't know what it is something for blood thinner. And because you take blood thinner, you can't take ibuprofen. But I messed up my pill taking time, and so I was 2 hours late with my Tylenol. And so I felt pain in my back. It was the first time I felt pain in my back this whole journey. For 12 days, I was getting used to having no pain in my back. I could see that when I'm done with all this, I would like to be able to take Tylenol and ibuprofen so that one gets rid of the inflammatory arthritis, the other gets rid of the osteoarthritis. And I won't need so much painkiller for my hip either. I don't know what it feels like without painkiller. I guess my incisions started to hurt. That's what it feels like. Anyway, so I had not staples. I had steri strips. I don't think he even stitched at all. He must have stitched somewhere inside or something. And they often do things several layers deep. But anyway, most people get staples on the surface, and he didn't use staples. So when they changed the bandage yesterday, it was supposed to, the steri strips were starting to fall off, which was good. And then I'm supposed to change it today, but I can't see where it is. It's not on the back, but it's on the side. It's called posterior, but it's just the back of the side, if that makes any sense. So it's mostly on the side, just enough that I can't really see it. And if I can't really stand up for a long time to stand in front of the mirror to change it. I guess I could ask Willem to do it. But I don't know. And then I suppose it's in 2 or 3 days that I can leave the bandage off altogether. I don't know. You know, sometimes when I write in my journal, it's really hard to keep my eyes open while I'm writing or typing to somebody. It's really hard to stay focused on stuff. But what time is it? Let's see.
9:45. Not 54.
9:45. So 10 o'clock is...
54, sorry. 54.
10 o'clock was the regular time of taking it. But then I was late. Anyway, I wrote it all down. Can you see when my last Trendol... what is it called?
Tramadol.
Tramadol, yeah.
Look, you get your Tramadol and your hydromorphone at 8.
At 8. I'm supposed to have them at 8, or I did have them at 8?
You did have them at 8, and you had your Tylenol at 7.
I did?
That's what it says.
No, I had the Tylenol last.
Okay, let me look at it again.
Writing everything down does not always prove very well done because...
3 o'clock you had all of them.
Mm-hmm.
7 o'clock you had Tramadol and Tylenol. And 8 o'clock you had
Tylenol.
Tylenol. It says on here.
Do you want to see it? Since I wrote it. Oh yes, the X means I didn't take that.
The slash, this means you didn't
Slash, and I didn't take it.
Right.
I
The
just...
quotation mark means you took it.
Yes, like a ditto.
Yeah.
Okay, so at 8 p.m. I took my Tylenols. So at midnight I take Tylenol. And at 7 o'clock I took my other ones. So in 4 hours from 7. So at 11...
Is it at 11 you can take Tylenol again?
No. At 11 I take the other 2 pills.
Oh, that's right. And 12 o'clock you can take Tylenol.
Right. And so now it's...
I don't think it matters if you take Tylenol at 11 too.
So it's 10.
So about an hour you can take your regular 4 pills, I would think.
Okay.
Tylenol is not very strong.
It's going to mess me up. I was getting pretty good at the 2, 10, 6.
Mm-hmm.
2, 10, 6, 18, 10, 44. That's the song. Please tell me if you can. What time do the trains roll in? 2, 10, 6, 18, 10, 44. I've been away so long. Sometimes my voice is better than this. Anybody can say that. Fought a war that's come and gone. I'll see if I can really do a good job. Doesn't anybody know my name? Doesn't anybody know my name? His name, her name. Please tell... my sister... Oh well, so much for the good voice. It's all over. You know, with this, having a hip thing, you're not allowed to cross your leg. And sometimes I want to cross my ankles. And I have to make sure I don't. Crossing my ankles is probably not as terrible as crossing my legs up higher. Anyway. Gee, I'm so blurry, so hard to see straight. Alright, so I'm going to give this back to you, Willem, darling, if I may. Thank you. Would you mind bringing me my Sudoku and a pen, please? So, if I can't focus, it's on by my chair, by the patio door. Okay then. Alrighty then. Goodbye. I still love you. Yes, I do. Do you still love me? Good. Thank you. Well, you can do this at home. Results may differ. And you saw it here last. Bye.